Dr. Layla Al Marzouqi, Al Marzouqi. I'm gonna be speaking about her. So she's a preventative clinical cardiologist. She's an aeromedical examiner. She is an associate adjunct professor of cardiology. Dr. Layla Al Marzouqi is a female UAE national cardiologist with over 20 years of international and local experience in hospital and clinical settings. She trained in Ireland and the UK. She is a preventative clinical cardiologist, aeromedical examiner, and associate adjunct professor of cardiology in Sharjah University and Dubai Medical College. She holds a diploma and 2 master's degree, a PhD degree, and fellow of American College of Cardiology. She studied in Ireland and UK. She is a board member in few organizations and has her own business. She was a director of Health Tourism Council and Health Regulation Department in Dubai Health Authority and president of Global Health Travel Council. Dr. Layla's excellent communication and public speaking skills have allowed her to be a frequent speaker in many radio and TV channels and national and international conferences. She was one of the key figures in unifying licensing requirements in the whole UAE and helped in developing Dubai Health Strategic Plan and many medical policies and guidelines related to licensing processes and quality of healthcare services. She established medical tourism projects for the Emiratis of Dubai. She obtained more than 20 national and international awards. Please welcome to the stage Dr. Layla Al Marzouqi.
Okay. Assalamu alaikum and good afternoon. Thank you for the introduction. I have no slides and I would like to start my talk with a little bit of my background, as she has kindly mentioned, but I think there were some words there that need a bit of explanation. So my background, I'm a heart doctor, and I teach in 2 universities in UAE. I teach cardiology, which is the heart disease. She mentioned that I was the aeromedical examiner. What does that mean is that we license and relicense the pilots and cabin crew because they need to have a regular yearly checkup, and I follow up that. So that was that aeromedical examiners mean. And as she has mentioned that I developed the strategy for medical tourism for Emirates of Dubai. That was one of the project of His Highness Sheikh Hamdan bin Mohammed, the Crown Prince of Dubai. And I was in charge of setting all the regulation for the healthcare facilities and healthcare professional working in Dubai. I've studied in Ireland and I was there for 10 years. So Ireland is my second home. And then I went to UK to do my other specialty. I'm currently working as a cardiologist, as a part-timer cardiologist, and I have, as she said, I've got my clinic as well. So today I will talk about the topic by name of the woman entrepreneur's heart. All of you have been talking about empowerment, entrepreneurship, and women, and the being on board of different firms. But I will take you to another way of talking in terms of the health of the woman entrepreneur. And then when I look, before I go into that, when I look at the theme for this conference, it says embrace inequity embrace equity. And when that theme that really attracted my attention, and I said, is there any inequity among women in heart diseases? And I was surprised to find, yeah, there is inequity even in the medical field. Women usually, they are 15% according to statistic, more than men in terms of attending medical school. But when it comes to working, men are more than women in terms of professional, so in terms of their number. And then even when they get sick, a study has shown that women, they tend to seek medical attention later than men, and even when they seek it, they don't get the same attention that a man get in terms of being treated as per the medical guidelines. And then the other thing is that is important to be highlighted is the women are usually underrepresented in the medical field in terms of research. And when we as a doctor review research, mainly the male population is bigger than female. So inequity, it does happen in the medical field, specifically in the heart sector as well. So the other part of this conference, it was empowering women, and a lot of my colleagues here in the morning, they spoke about empowering women, but I will look at other aspects. So study has shown that women who are being entrepreneur and they have their own businesses, they are more prone to diseases. And that's basically because we women handle stress different than men. And a study have found that unfortunately, the entrepreneur women, they were more prone to bipolar depression, they were more prone to breast cancer, unfortunately. It all because the way we deal with the stress and that all and how that affects our immunity. And then how we, of course, we have to deal with, as a woman, if you are working, so you have two jobs. Your job is your first work, and the second outside home, and the second job, I call them domestic engineer, because when you come home, then you have your kids, you have the husband, that you need to look after them. And some people, they balanced it well, but some women, unfortunately, they have ups and downs, and nobody as a woman, I think they were all having ups. A lot of people, a lot of women, I'm sure they have times when they're down. And the story of myself, I usually do few notes, يعني مذكرات, memories I do write sometimes. And I was looking at all the stuff the other day, and I saw a note of mine in 2015, documented writing how stressful the work was. At that time, I was a mother of 3 children. My children, they were small, and I was working as well. And reading that note, it really kind of like opened up my mind, and it was about how stressful it was, and I don't know whether I can continue like this. I'm not matching the demand of my family with my job. But that was time when kind of like my downs, but I had the ups situations as well. And I think women, when they are at their downs, they need the support of the husband, they need the support of their family. And I think none of the achievements that I've done, I could have done it without the support of my husband. Okay, so going back to the health of the women, the health of the entrepreneur women specifically, we women are unique in everything, and even we are unique in the symptoms of heart disease that we present with. So women, they don't usually present with the classical symptoms of the textbook, the symptoms that they mention for heart disease. So that's why when I do any educational session, I tell women that any symptoms that you have, any pain in the chest, or even your upper part of your stomach, if it's hurting, or if you're dizziness or tiredness, you should always consult your doctor and not leave it till it's very advanced. We are women, we're busy, yes, we have to look after a few things, but unfortunately our health is not our priority most of the time. So any sign, I always tell my friends, listen to what your body is telling you. So if your body is saying that I am tired, if I have a pain, if I feel like drained, listen to the body and see what's the need of it and fulfill that need until before it is too late. Especially when the women are drained and their energy needs to be, or their battery needs to be recharged, as I say. We have to listen to that and do it. Otherwise, we have some kind of like a side effect of the stress and the tax we have to pay as we decided to be an entrepreneur and to have businesses and to go and to be empowered. It's a disease called broken heart syndrome. Women, unfortunately, they are more prone to it than men. It's because of the nature of their physiology and the way they handle stress. And they present with chest pain, and they present with similar symptoms as somebody is having a heart attack, but actually it's not a heart attack. And this is because of the stress, being loss of some beloved one, or hearing a bad news about a business, etc. So women are more prone to this. So I always tell my patients, listen to your body and have time for yourself. And I say, work hard and relax hard as well. Have time for you to recharge your battery. And when you are resting, switch off and have time to yourself and enjoy it, and enjoy your family as well, because your children will be growing very fast, and then they're going to leave the nest very, very fast, and then you suddenly realize that it's too late. So enjoy whatever you're doing and enjoy the family as well, and put time for the exercise. I usually say it's 150 minutes per week, or half an hour walking every day. I know you have to take it out of your busy schedule, but do it for yourself and do it for the family, and take care of the food which you're eating, and have a regular checkup, being your heart checkup. And of course I can see men in this room, and they have to go for the regular checkup, especially if they have any family history of any heart disease, or if they are smokers, or if they have risk factor for heart disease like high blood pressure, high cholesterol, and diabetes. And I always say prevention is better than cure.